Hi guys, Oily here. My camera is not working, so I'm going to refresh in just a second, but I want to say hi to everybody and thank you so much for being here, and share this up so that we can get other people over here so they can learn about what they need to put into their trauma kit and why. And that was me. Luckily, I caught it before it got too bad. Got my external volume still going, so.
And my cat likes to jump on my laptop, so may be random stuff in the in chat tonight. So sorry.
Okay, let me ask you this, Okla Prepper.
Who
is Let me ask you this: is cat urine sterile?
I have no idea, and I don't want to know. All I know is he's annoying.
There's Squib. Hey, Squib, welcome.
Hey, I just got off a hangout on gun channels, just talking to a couple guys from Michigan about meeting up.
Ah, nice. Refresh this page here. Hold on. Not wanting to let me. Well, I'll just have to do. I'll just have to do with my volume just being, or not my volume, my camera just not working. So I don't know.
Is that any better?
I turned volume up on everybody.
You sound real good, Oklahoma.
All right,
yes, you do.
I want to cover something really quick. For those of you in Oklahoma, there is a wildfire in the Quartz Mountains. That is over around Ardmore area. There are several. The Oklahoma Forestry Service is on that fire at this time. There are several other fire departments out there as well. This is fire season, so be mindful about any outdoor burning. Be very careful as to any outdoor work that you're doing, such as welding, using cutting torches, anything like that, because any small spark can set a wildfire. And also is a good time to remember on, I've got a video in my page, in my channel, about how to protect your house from wildfires if your house is being threatened by wildfires. You can keep up with this information by going to just Googling Oklahoma Forest and looking up, or on the Oklahoma Forest Service Facebook page, and by looking up on Oklahoma Forest forestry.ok.gov and go to situation reports, and then you'll go to Oklahoma Fire Situation Report, and that will tell you any updated information, and that is updated daily from usually by Drew Daly. He's a friend of mine. He's also one of the big incident management incident commanders on Forestry Service. So, okay, there is that as far as news that I've heard over the week.
You know, what's interesting about that being Ardmore, it was such a small place. I have a friend who grew up there, and of course now they have a big casino, but that would be extremely frightening, being there in such a small area with just X amount of roads out.
Yeah.
A friend with a casino?
No, friend who lives in Ardmore, they have a casino there now, so there's a lot more at stake than there was back in the day. That's where people work.
The casino's what put them on the map now?
No. It's just there's a lot, you know, a lot of jobs were provided.
Yeah, Michelin is out there, and a couple other companies, but it's one of the largest casinos in the world. It's Windstar World Casino.
I think we need to build a pipeline down there and get you guys some water from the Great Lakes so you can put out all your fires.
Yeah, we'll take it.
We got a butt ton of fresh water up here. Y'all can have it. I'll loan some to you.
Send it.
Exactly how much is a butt ton, Squib?
Well, it's less than an ass ton. And I'll refrain from using any other swear words to go into a higher unit of measurement.
Yeah, thank you very much. With that being said, we had an incident last week where somebody didn't exactly put the words, but when you said the words, it made it sound like the words that were naughty that they were wanting us to say. So let's refrain from that, people. You know,
And I'm sorry, Oily, I had a lag. And that I read out loud, and if I see him, I'm going to juice him with my blue wrench. So don't get stupid, because I'm going to swing it and juice you.
Yeah, let's not do that. You know, you're
The blue wrench?
not worried about the cussing, and that's
The
fine.
mod.
In your
the
own
blue
life.
wrench is for the mod in the text chat.
Yep, see the little blue wrench squib? And see, WeTree was all up on that and deleted one. And we just can't play word games and then we read them out loud and it's just vulgar, you know?
And
I've learned another internet term. Thank you.
And you guys, if somebody that does have a wrench, yes, there's a lot of people that have wrenches. That doesn't mean they're all like the Nazi police or something like that out there. But, you know, I told them I'm pretty lax on my rules, but I don't want vulgarity and I don't want, you know, the F-bomb or using the Lord's name in vain, things like that. I don't want that over here. And, you know, I think we're adults. We're intelligent enough to find other words besides cuss words to use. So
I think
that's why I didn't go any further with the units of measurement.
Oh yeah,
thank you.
You're never offensive, and we've made things like powder on genitals and bug out bags.
Okay, let's not go over the genital stuff again.
But we haven't done it. We've done things or tried to where it was not vulgar. You know, we have hashtag urine, but you know when we were talking about something regarding that. But we can still have a good. We can still have fun without just being disgusting, you know, because I have to leave chats just because they reach a vulgarity level. It's just too much for me, and I'm not easy to offend at 60 being from New Orleans, Louisiana.
BC Truck is out there, and he says that he's intimidated by all the Nazi wrench wielders here. What about free thought and expression, man?
Hey, BC, you got to act, man, like your priest is in here, you know what I'm saying? And the nun, and keep it all on the down low. Like, what's the difference between a Catholic and a Baptist? When your priest comes over to have dinner, you pull out your best liquor. When your Baptist minister comes over, you hide all the liquor, right? You just have soft drinks and sweet tea. You know, so just act like your priest is here. That's all. Hey, BC, you're such a good egg. You're never gross.
Hi, Finger Lakes Prepper. So yeah, just try to. We're intelligent people, and we can have fun, but we don't have to use naughty language to put our point across.
Hey, Oily, I just noticed I've got a wrench too. So after all of these years, I finally get to be one of the cool kids.
Yeah, of course.
I've waited so long.
You know, they shouldn't hand out wrenches. Like, we should get, like, you know, AKs or AR symbols.
That would be more better.
Nah, I fix stuff for a living. I'll take a wrench.
He's got a free tool, and it's blue.
Okay, so today, everyone, thank you all for coming, by the way. We appreciate it. We're not trying to ruin anybody's fun, but we can have fun without being, you know, awful. So today our topic is going to be trauma kits. And, you know, this is my list, and everybody's going to add their own thing to this. I know I've not covered every single basis. The Oklahoma Prepper is the one that's a trained EMT here, so he's going to be elaborating on a lot of this. I've been trained on some of this for emergency rescue and emergency rescue lifeguard, like major situation, but I haven't been trained like as a true EMT. So I look forward to learning from the Oklahoma Prepper today. I appreciate all of his input on all subjects, especially today. So with that being said, trauma is basically a major or life-threatening injury, okay? So that's what we're talking about. This is not your basic first aid kit that has just a little, you know, those little bitty bandages and Neosporin for boo-boos. This is, you know, you're trying to stop bleeding, stabilize an arm, a broken joint, puncture wounds, knife wounds, gunshot wounds, things like that, neck injuries. So yeah, that's what this is about. And I will tell everybody, just like with the emergency dental kit that Rain just mentioned, I will put this full list over on Steemit on a post tomorrow morning. So that way you can go over and you can just copy all of the list and print it off. I'm not.
And your Steemit link is on your front page of your YouTube now, right?
No, it's not on the front page of my YouTube, but it is in the description box below on the YouTube channel.
Okay,
So,
it's easy to put a link on your front page here to Steemit, your Steemit page.
Yeah, I know. I just haven't got it done yet. I've been fighting a major headache for the past.
Somehow I just feel like I asked you to have sex, and all I'd asked you was to put on a link on your YouTube page.
Hounding me about it. Dang it!
I'm a hound.
All right, hang on. I'll be right back again.
Okay. All right. So I have the list over there. I don't copyright my list. I want everybody possible to be prepared. So if I create a list, you just copy it and paste it into your computer or your phone and have it there to access, print, whatever you want to do. Now, I would probably have an issue if you just went off and told everybody that was your list, you know, but otherwise, you know, I don't mind. Thank you, Raintree, for putting my Steemit account on there. Oklahoma Prepper is back. So the first thing I want to tell you that you'll probably want to get all your items first and see what size of a bag you're going to need, because it's going to depend what all you put in your kit. So,
yeah, I wanted to mention that AMP3 is a website that has some IFAC and blood stopper kits that, you know, are relatively reasonable priced. They're all kind of organized.
Okay, I'll check into that.
Yeah, I'm screen sharing it. I hope. I don't think I can put a link in myself. But yeah, anywhere, but maybe you could add it to your list.
Okay, I wrote it down on here. Yeah. Jared Walsh is out there now, also joined us. Rain Country, Finger Lakes Prepper, Living Frugal and Prepping. Wood Load is in the external and the internal. Let's see, we've got BC Truck, Rebuild, Repurpose. See, I saw where your little fur baby was barking at the cat. Well, that's just a routine. Don't get onto your fur baby for that. It's just a routine. Every morning, it's the routine for the two of them. The cat goes out and taunts him, and then he barks. That's just how it is. So,
the cat barks?
It's their shtick.
BC's dog barks at the cat. So, SKS Hugo, good to see you. Okay, well, I'm sure I missed somebody. I is out there. Sandy's stopped in. Elu Mompitiste. I don't know. Elu is out there.
That's as bad as hidden new Kojo
is out there. Okay, Kojo, Joe, keep the language clean, okay? I love you. Keep the language clean. Be nice, boy. Okay.
Did you say Wee Tree Bonsai?
Wee Tree Bonsai.
Yeah. Roundhouse.
Yes, I'm sorry. I didn't mention Wee Tree. We got to make sure we mention Wee Tree. Wee Tree's my favorite, bestest friend in the whole world.
She's our boo.
She's our boo, man. Okay. So the bag you'll probably want to save to last till you get all your items, because you're going to need to know you're going to need. Athrenas is out there too. Hey, Athrenas, okay, so I like the Voodoo tactical bags, and if you do it down to where I say if you have more bag space than you can add these additional items, then all of the items that I mentioned will fit into a Voodoo tactical bag, just one of those small bags, like what you can throw into a stomp pack or something. Gloves, non-allergic preferably, and non-powdered. Goggles to keep bodily fluids out of the eyes, like blood, urine, vomit, spit.
Ew, vomit.
Face mask, keep bodily fluids out of the nose and mouth. Curved hemostat for clamping off vessels and arteries. Trauma shears for cutting off clothes to fully see extent of wound, and for cutting open packages, and for cutting off bandages. Now remember, I had down bandage over this with our little expert here, Oklahoma Prepper, and he said make sure it's not just bandage shears but trauma shears, because those puppies are made to like cut through zippers and stuff if need be. So shears better. So make sure you get those. A CPR mask used to protect you while administering CPR. Let's see, a marker. And if you guys have other uses for these items, let me know. Jump in. A marker. Whenever you're using a tourniquet, there's a space on the tourniquet for you to be able to mark on there when the tourniquet was placed, because they need to know if they're going to go to an emergency situation. Now, if this is the end of the world as you know it, you still might be able to find somebody that knows more about medical than, say, I do, which just about anybody else. But you can also use the marker not only to put the time that you put on the tourniquet, but also you can mark a T on the forehead. That immediately lets them know this person has a tourniquet. You can also use the marker to mark the line where venom is, like whenever, and the time to see how fast venom travels through after getting a bite from a venomous snake. Transpore tape can be used for wound closure. Strips and pull. Once the wound is clean, you can pull those together if it's not a major bleeding issue. Latex-free tape can be used to splint fingers, making improvised chest seals with plastic. Aftercare on wounds once bleeding has been stopped and patient is stabilized. Bandages. If used properly, now you guys need to all go and YouTube, hey, Step 1 Survival. Each one of you need to go and look up how to use an Israeli bandage and a cat tourniquet, because there's a specific way you apply the Israeli bandage for it to be used properly. It isn't hard, but you do need to look up how to do it. If properly used, this bandage is used to put pressure on a wound without creating a tourniquet. You don't want to cut off blood supply unless you absolutely have no other option. If you can't get the bleeding to stop, the way I understand it, you want to do that first. If you can get the bleeding to stop, great. If not, then you want to apply the tourniquet. But for an Israeli bandage purpose, you do not want to cut off the blood supply. You only want to apply a lot of pressure to help reduce the bleeding. Oklahoma, are you here yet?
Yeah, I'm here.
You can hear? Okay.
I think the important thing to say is when you're out shopping for stuff on Amazon or whatever website, is not to go overboard and get like stuff that you just would never learn how to use without, or know how to use without, medical school training and stuff. So, like you don't need a full surgical, setup or anything like that. So like there's stuff you just won't ever need because you don't know how to use it and it's just beyond you. And then there's stuff that, a regular person can use. So
Step 1. Yeah. Sorry, I thought you were done. Step 1 Survival is an EMT medic also, so that's great. So we have Oklahoma Prepper and Step 1 Survival as EMT trained. Wonderful. Let's see. Do you want to explain, Frank, what our next thing is? It's a cat tourniquet.
As far as tourniquets, let me open my EMT book back up. Some of this stuff has to be a refresher for me as well. Tourniquets, as far as labeling for tourniquets, she mentioned put a T on the forehead. The proper way, or the way we were trained as EMTs, is put a T / and K, TK, and the time that you put the tourniquet on, so that if you can get to higher levels of medical, that you will know exactly where and what time, or what time exactly you put the tourniquet on. That way, it can they can actually be able to protect the limbs or the extremities a lot better. Um, I know a lot of people. Real quick, I want to bring you guys that are familiar with how to deal with medical emergencies. I want to bring you guys up to date, especially on the tourniquets. And I was talking to Oily about this before chat. Tourniquets were recently reinstated back into the EMS protocol because the only thing good comes out of war is medical advancement. And specifically with tourniquets, they have found that at one point they thought that using a tourniquet could actually do more damage than good.
It's a hell of a way to advance medicine, but go ahead.
Yeah, unfortunately. However, they found that during battle and war, that tourniquets actually did the job that they were originally designed to do, and so they brought tourniquets back in. So as far as tourniquet placement, you want to apply the tourniquet about 2 inches above the bleeding wound and not directly on a joint such as the elbow or the knee, but further up on the more distal from the wound towards the body, away from the wound on the joint. Yes, Frugal has a very good point as far as bleeding control. Feminine, what are they called?
Maxi pads.
I was trying to. Yeah, that's pretty much the name of it, but sterile feminine
is what you're trying to say.
Napkins, yeah, do really good for controlling bleeding.
I believe that advanced combat tourniquets were rated like the #1 military invention, recently, as far as life saving goes on
oh yeah, that's the last thing you want to do is use it. You want to try to control the bleeding first, but sometimes that doesn't always happen. And again, you need to look up how to use a cat tourniquet. The reason why I like cat tourniquets out of all of the ones I've researched is C-A-T, because you can apply those one-handed. There are a few out there that you can apply one-handed. So if you're the one that's injured and you're needing to get that on you as quickly as possible, you want exactly. You've got it. If you're having that severe bleeding, you've got to get it done, and you've got to get it done quickly. So you need to be looking at
hurt when you do it.
And if it's not hurting, you ain't got it tight enough, people. It's gonna hurt. It has to hurt in order to be working properly.
Yeah, and the thing is, is to get the patient to the emergency room or the medical station alive. Where there's because if you get them there alive, then you have a whole team that can save them. So. Once they hit the hospital, you've done your job. So you have to get them there alive. That's it.
And who was it said EMS1 is a great place to go to learn? Was it EMS?
Yeah, EMS1.com. If you can tolerate, I don't even know if anybody can hear me. I think I'm lagging.
We hear you.
Okay. EMS1 is a good site for free training. However, I will defend them to the T. However, that you will see stuff on there that you do not want to see normally. If you do not have a strong stomach, do not go to that website. And that is a training website for EMS personnel and professionals. So if you cannot handle what you're going to see, then please do not go on there, because they get a lot of bashing about HIPAA violations and stuff like that, and it's gross and it's not for the internet. However, that is for training purposes only. Really quick, as far as tourniquets, I will be posting a video tomorrow on how to make a tourniquet out of a piece of cloth such as a bandana and a stick or a ink pen or something about the something along those lines. So I will post I will post a video on YouTube and Steam it tomorrow. So if you haven't subscribed to my channel, subscribe and hit the notifications. I'm not trying to get followers. I'm trying to help you guys and teach you guys about this stuff. So that's that so far on tourniquets. And really quick, I want to deviate from tourniquets, but this is related. When you are dealing with tourniquets on a patient, expect shock. If you have blood pressure cuff, make sure you monitor the blood pressure of the patient. And when they start to tell you, hey, I'm starting to get cold, and if it's hot, then make sure you're monitoring their blood pressure. If their blood pressure drops, then they are going into shock. Cover them. Make sure they're laying flat on their back, and cover them with a blanket. They say to lift their feet up. However, they've also recently come to figure out that the Trendelenburg position, which is laying supine on your back with your feet up, actually does not do anything for shock. So make sure you lay them flat on their back and cover it up, and monitor their blood pressure and heart rate as well.
Okay, good to know. Okay, so thank you very much for that. The next item is Celox A granules in a syringe, and this is a stop bleeding type product. You've heard of probably a lot of others, but the reason why I suggest Celox A, and I got this from Nurse Amy off of Doom and Bloom, is because unlike a lot of the other stop bleeding products, Celox A will actually block the bleeding in patients that are on blood thinners, which is very significant. So a lot of those others will not. Also, by using a syringe, if you have a very deep puncture wound, if you're going to pack gauze into that wound, it's not going to necessarily get down to the area where that bleeding is occurring. And so you can take the syringe and shove it into the wound down as far as you can go, and then put those granules in, push them in with the little plunger on that syringe, and get it down there where it needs to go to help stop the bleeding. So I suggest the Celox A. You need to do your own research and see what you feel is best for you, or maybe pack more than one type, but that's the kind that's going to go into my kit. Anything else on the stopping bleeding stuff, Oklahoma?
Yes, you can use anything such as feminine napkins. Make sure anything you use is as clean as possible, because you want to try to fight infection. Now, the best thing for stopping bleeding, if you cannot get a hold of a tourniquet, or if it's not severe enough that a tourniquet is needed, is a direct pressure. And I need, can you turn that light on, please? I'm going to get a pen and write all this stuff down, because I am going to make a video on each thing that I'm talking about, because this actually will take time, and I will show you how to, there you go. I will show you how to apply direct pressure in several different ways. That way you can learn how to stop bleeding without a tourniquet, without the use of a tourniquet if a tourniquet is not needed.
And see, okay, so what I've heard was by using compression or direct pressure, if done properly and for long enough, you can stop 80 to 90% of most heavy bleeding by doing that, correct?
Yes, absolutely.
Okay.
You were talking about the granules.
Having to remove them.
You roboted out on us, Frank.
Okay.
There
Hang
you
on.
are. We got you.
Alright.
You're back.
Okay. Some of them can be left in the wound safely. However, for fear of infection, I would not, because basically what that is that, and I'm not trying to be gross, but I'm trying to be brutally honest. What you're doing is you are sealing up a wound with basically a fake scab, and that can cause infection. Basically, what that's doing is that blood is dried up and it's rotting, and that can cause deadly infection. So that is something that you want to be mindful of. So you can go out and buy, and I'll type it in the chat. It's called Quick Clot, and you can buy it at Walmart, anywhere.
Isn't Quick Clot? Gosh, anyways, isn't Quick Clot the one that does more like a burn type thing in there, or is it not? I thought the Celox was the one that could be washed out easily. Am I wrong?
It's all basically as far as the blood clotting powder, whatever.
You're cutting out again.
Finga makes a good point. It all depends on if you have a trauma team to get to as to what you use. And for most of us being remote and rural, there's not going to be anywhere to get somebody. We're going to have to do it.
Right. And Celox, other than the tourniquet, Celox would be one of my last resort, you know. But if I needed to get it stopped and compression didn't work, then I would probably try the Celox. And then if that still did not take care of it, then that's when I probably applied the tourniquet. Now, I could be wrong. I'm not professionally trained on all of that.
All of these situations we're talking about are life and death situations. You don't use this stuff, you know, for minor things. It's
exactly. If it's something
if somebody's going to bleed to death before you can get them to an ER, then you have to save them. You know?
Right. You do what you can in the situation, definitely.
Step 1 says direct pressure is the best way to stop bleeding. Is direct pressure and elevation if possible. And a lot of times cleaning up the wound and finding wet, because like if you have a scalp wound, it's going to bleed like crazy, and you're going to find out it's very small. And one is just cleaning up the whole area and see what you're dealing with. And it's also not always huge, and then it's just a matter of infection.
Yes.
Elevation above the heart or head if possible.
Yes.
And infection isn't a minor thing. That's how, like, you know, most people died before antibiotics became, you know, widely available. So you definitely want to try and prevent infections at all costs.
And step 1 also says that quick clot will cause an infection if you don't clean it thoroughly. It's not a quick fix, so be sure you remove it from the wound and then you stitch them up properly. And that's the most fun, is stitching people up when you're not a doctor, because they scream like freaking girls.
And they'll look like Frankenstein by the time you're done with them.
Yeah, act like a tattoo artist and have some fun.
Just like I said about using any of those clotting powders or granules, that I don't trust them to stay in the wound because of infection, the chance of infection. And somebody was mentioning super glue. Super glue is a good fix if it is a laceration. Not necessarily for something such as an avulsion, which is basically a layer of skin sliced out of you. Let's see, maybe I'm not sure how to really describe an avulsion. maybe step one could better describe it for you guys.
Would it be like a tear wound? Like say there's a dog bite. You don't want to suture that puppy up, right? For the risk of infection. You want to make sure that puppy's open and you keep it thoroughly clean, right?
As long as you get them clean as possible, you can suture them up. There's always, when you're in a situation where you will not be able to get to an emergency room or anything like that for any reason, if it's end of the world type stuff, then there's always going to be a chance for infection. So expect that. If it is something where, hey, I've got to stop the bleeding long enough to get to the ER, then anything can be done. And once the patient gets to the emergency room, then the wounds and everything can be properly cleaned. So as far as super glue, super glue can't seal everything. And I will also make a video on the different types of lacerations, avulsions, and stuff like that. That way you can kind of see exactly what I'm talking about, what can and cannot be.
Okay, so here's a question that everybody might want to know. What's better, super glue or Gorilla Glue?
Super glue. Gorilla Glue is actually a foam. It's a binary compound. Once it is exposed to air, it turns into like a foam. So stay away from Gorilla Glue. Super glue was originally invented for lacerations. So that is something I would take into consideration.
Okay, and all those, I like the gorilla in their commercial, but okay.
Use the Gorilla Glue to repair tarps and things like that. Let's not use it for wounds. Okay, the next on my list is chest seals, and I recommend, after watching various videos and stuff, is 2 chest seals, at least 2 chest seals to have in your bag. Those are used to allow a wound that is a sucking wound, like a sucking chest wound. Like say it's a through and through gunshot wound, you can put 1 chest seal on the front, 1 chest seal on the back. What it does is allows air to escape, but it doesn't allow air to be sucked back into the chest. So that is one thing that I recommend. If you have 2, if it's a through and through gunshot wound, you put 1 on the front, 1 on the back. If it's just going in and that's it, you can just put it on the front, or however that goes. They're good for gunshot wounds, stabs, and deep puncture wounds, things like that, for sucking chest wounds.
Sucking. That's why I say my weapon of choice is a gun, because a gaping chest wound takes the fight out of a man, and a sucking chest wound makes exactly that noise. You will never forget the sound. It's all gurgly, and you little bubbles, and you're like, oh, that is nasty.
Yeah. And the next thing on the list, H&H primed compression bandages. What they are is they're basically, they're vacuum sealed, so they're sucked down. They're compression bandages, and when you cut into that package, just this big spring-loaded bunch of bandages pops out. And that's great. If you need something very quickly, you can cut it open and you can have it, stick it on the wound and compress down to try to stop the bleeding. Another thing would be rolled gauze, used to clean the wound, or to put over the wound to absorb blood while applying compression. In Oklahoma, just jump in whenever you want to add something to it. Alcohol and betadine wipes for cleaning the wounds and your instruments and your hands, etc. If your bag has space, I recommend number 1 on that, an adjustable C-collar. And Oklahoma's going to tell you and show you how to determine what size you need to put that adjustable C-collar at, because you can cause more damage, from what I understand, from what he
You
told me,
choke 'em.
if you don't apply it right.
Yeah, I've got to close out my external, so if anybody's chatting in there and asks me or brings up something, let me know. So
Okay.
I'm going to try to make it to where I don't get all real body on you. But as far as C-collars, you want to know how specifically to measure a C-collar or cervical collar for stabilizing the C-spine for fear of neck fracture. What you want to do is you want to put your hand flat. Let me go ahead and turn the camera on so that I can. Okay. What you want to do is you want to hold your hand just like this, directly right on the clavicle, right up against the neck, and however many fingers you count from the bottom to the top to the jaw line is how many, what notch you're going to put that C-collar on, because those adjustable C-collars adjust in height from the clavicle around the clavicle and up to the jaw and back of the head, and that is specifically for different size necks. A C-collar that is too small, that is too low, can not provide the support needed for a possible neck fracture. A C-collar that is too high may possibly cause more damage than what is already there. So you have to be very careful.
Yep.
And Elu says that alcohol for the tools and hands, betadine for wound flushing. Good to know. Thank you, Elu.
And betadine is still affordable. One of the few things you can afford.
Oh, yeah.
Oh, no. And look at Penn wants to waste vodka on their pain. How about our pain? After having our hands, 2 inches deep in their sucking chest wound, that vodka would be for us. Okay, they're going to ride there in agony, but at least we saved their life. No vodka for them.
It'd be for our trauma after we treat them, right?
Yes, PTSD. We need a little liquor therapy.
I'm trying to remember that
mercy.
movie. It was a Western where somebody gets shot and the doctor comes running over and says, "Whiskey, quick." It's for him, it's for the doctor, it's not for the patient.
Okay, another thing would be a finger splint. It's to stabilize and protect an injured finger. Also, like Oklahoma told me in the pre-chat, it also helps to apply pressure on a bleeding wound on the finger. You can use tape to stabilize and splint a broken finger or whatever, but if it has a deep laceration, the finger splint would be good to have. And Steri-Strips. Yes, indeed. Need those. So have those on hand. Know how to use the suture kit, okay?
Practice on an orange.
Huh? Practice on an orange?
Practice on orange. Mm-hmm.
Orange or pig leg?
An orange. An orange, the fruit. I can't talk. Sorry, I had a lisp.
Orange. That's what my granddaughter calls it, an orange. A chest decompression kit. Now, you need to be properly chained for this, but if somebody's dying in front of my eyes and I know I'm not going to get sued by somebody, if it's the end of the world scenario, yeah, I'm gonna attempt this, but I want to get proper training for this. But it consists of like a number 10 scalpel and a decompression needle to get air or blood, fluid, whatever, out of the chest so that it allows the lungs to expand again. Breathe. Small flashlight to check pupil reaction, throat and mouth wounds. Oropharyngeal and nasopharyngeal kits, various sizes. Learn how to use them. Collapsible bag valve mask and a manual suction device such as a VBAC. an EpiPen, if you can get your hands on one, to use for severe allergic reactions, anaphylaxis. Just your allergic reactions.
I thought those had to be prescribed by a doctor, and if you give somebody the wrong EpiPen, it might not work.
If you're dying in front of me, I'm going to attempt it.
Well, that's true. A fighting chance is better than no chance at all. True.
Exactly.
EpiPens.
Bingo.
Epinephrine is all it is. It's a synthetic adrenaline, just like you see in the movies where they shove that needle in the heart and people just come back to life. That's the same stuff, only it goes in the thigh. As far as I know, I've never heard of there being different types of epinephrine. As far as allergic reaction and anaphylaxis shock, you need to know the difference between the two. Allergic reaction could be something as simple as getting itchy, start sneezing, stuff like that. A lot of people have allergies. Just because you are allergic to something doesn't mean that allergic reaction will not cause anaphylactic shock. Anaphylactic shock is a deadly reaction to an introduced allergen, such as bee sting or fruit or nut allergy.
Peanut butter. Peanuts.
People are allergic to nut allergy. People are allergic to chocolate. People are allergic to watermelons. Stuff like that. Strawberries. One of the early symptoms of anaphylactic shock is their lips and tongue begin to swell, and they start to get rash on their body. If they said that they are allergic to something, expect anaphylaxis. And if they are still awake, if they are still awake, administer epinephrine, the EpiPen in the outer thigh. And if they do go unresponsive, and you are trained to use an oropharyngeal or nasopharyngeal airway, use them, but be careful as to not tear the trachea. So there's a lot of, you've got to make sure you know the difference between anaphylaxis and just a simple allergic reaction.
Absolutely.
Oklahoma Oily, I don't have any experience with EpiPens. I'm just parroting what they tell us every year in first aid training at work. And I'm not saying the first aid training I get at work is very good because the instructors are not nurses or EMTs or that sort of thing. I really wish they would use somebody like that for the training. I think we're looking at the liability of if you administered a prescribed, because they're saying you can't just go to Walmart, to the pharmacy and get an EpiPen. You have to have a script. So if you're saying the epinephrine works, and it's just kind of a common thing, I don't know why they would tell us that, because in Michigan we've got a Good Samaritan law, and if you try to assist somebody and you don't help them or you make it worse, they can't sue you because you're trying to help them. And I don't know if they have that in other states or whatnot.
There's some of the laws really suck. I mean, especially with regard to prescription drugs. Like if I have to take every day my metoprolol or metoprolol, whatever it is. But if you take like a prescription bottle and you hit, let's say it's for 30 pills and you have like 40 pills in there, then that's a felony. And if you go through the airport and they count it and it's different, you could be in big trouble. So they just have a lot of dumb laws that you have to be aware of. If as far as drugs and how many pills are in your bottle has to match exactly what's on the bottle and stuff like that.
We have Good Samaritan law in South Carolina too.
Okay.
We have it here in Oklahoma.
Yeah, see, I would like to know more about the EpiPens, and like I said, I really wish that we had a bit more reliable training. They have people who have been trained to train people, but they have people with no no medical experience of any sort teaching first aid at my work, and I found that my battlefield first aid from the military 25 years ago is better than some of the stuff that they give us. I mean, granted, we didn't learn how to use AEDs back then and that sort of thing, but I wasn't trying to dispute anything you were saying. I'm glad you kind of clarified that some, because there are lots of people with allergies out there. I've never had to deal with that stuff, so I have no idea what it's like.
I'm not saying that that there is not multiple different types of EpiPens. I'm just saying that I've never heard that. I've never been trained that. If a patient has an EpiPen, then we assist them with their EpiPen. So I'm under the impression that epinephrine EpiPens are no longer a prescription. You can go and get them at like a Walgreens or CVS, and I think that is true. I'm not sure. If somebody knows absolutely for sure, then please fill me in, because I would like to know for sure if they are available at CVS or something. Then I can go and get one just in case somebody around me has anaphylactic shock.
I've heard that there is a generic one out now. I don't know about the prescription wise or not, but I've heard that there is now a generic one out, and it is less like instead of $100 and something bucks or more, it's like $20 or something like that. I can't remember the exact amount, but it's much, much cheaper. It's much more affordable, because there are people that die because they can't afford, even after a prescription, pays on it, they still can't afford the pen. So there's now another one out, but there's a name brand EpiPen, but or the generic thereof.
Yeah, who knows what's going to happen with the healthcare system? And they're trying to figure it all out. That's a mess.
And I think EpiPens, they told us also that they have expiration dates. I mean, something's better than nothing, once again. So
I read something that drug expiration dates are just legal things where you're legally supposed to throw it away. But
I kind of think it is to get you to buy more, because healthcare costs so dang much.
Well, it's just that they're still effective, from a prepping situation. But from a legal standpoint, if you have pills that have expired, then or you have an old prescription, don't bring it through an airport security check, because if you have an expired pill bottle, that's a felony too. I mean, nowadays everything's a felony, when it comes to drugs.
Yeah. So, yep, you got to be careful. Okay, the next on our list is a Mylar blanket. It can be used to either keep a patient warm if hypothermic or to prevent shock. Large triangular bandage to stabilize an arm injury. Large syringe with saline solution to clean out a wound, clean area to see where bleeding is coming from.
Yeah, that's not so much trauma, but as in post-trauma care, I have bottles of saline solutions, wound wash.
If you're trying to see where the bleeding's coming from, so you can clamp off that vessel, then you want to be able to wash the blood out long enough to be able to see where it is you're trying to clamp. And then the instant ice pack can be used to reduce swelling. Yeah, this is more post-trauma. Reduce swelling and to cool overheated patients that have hyperthermia. So, yeah, a couple of those in your pack, and you can put one at the core of their bodies and help them to cool down a lot more quickly. Or those with a high fever, if they've got a really high fever and it's enough that it's causing major issues, until you can get them help for some. And then instant...
Real quick, I want to explain to our viewers and everybody in chat the difference between hyper and hypo. There's hyperglycemic, hypoglycemic, hyperthermia, and hypothermia. The difference is hyper means higher, hypo means lower. So a lot of people are going to, there's going to be a lot of issues with most commonly blood sugar. People are going to say I'm hyperglycemic, I'm hypoglycemic, and the knowing the difference between hyper and hypo will help you make the right decision in intervention.
Yes. Well, hyper, if you think hyperactive, somebody that's overly active, you can remember it that way. So that helps me to remember it. But like if they're hyperthermic, that means that they are overly heated. They're overly hot.
It's just a fancy way of saying overheated, which can, that's definitely want to sit on an ice pack and put an ice pack on your carotid artery and get in the shade. You're overheated.
Yeah. And then an instant hot pack for basically the opposite, to warm up a patient in the event of lowered body temperatures or hypothermia. Does anybody else have anything else to add on those?
Yes, I do.
Okay.
When you are applying hot packs or cold packs to fight hypo or hyperthermia, apply them. This is going to be uncomfortable, but it is very imperative. Apply them to the wrists, neck, armpits, around the ankles, and yes, in the groin area. That is those areas are closest to the major arteries to help circulate warmer or cooler blood throughout the body to help combat and intervene with hypo or hyperthermia.
Good to know.
I found, just after I go on a long hike or walk, just lay down with the ice pack on your neck and right next to your artery, and you'll cool down pretty quick.
Okay, Oklahoma, do you have any additional items that you think need to be added into this?
Yeah, there is. Can you hear me?
Yes.
Yep.
Okay. Real quick, I wanted to mention something that if you fear that a patient is having a heat stroke or is overheated, do not put anything cold over their head. That will induce a heat stroke.
Oh.
Okay. So, and yes, there is a couple of things that I wanted to add to the list, and I will also go over basic trauma in another video as well. As far as splinting a fracture or a sprain, you can get on Amazon and you can look up SAM splint, and they are very, very inexpensive. There are multiple uses for these things.
That is true, and I do have one of those, and I did leave it off my list. One thing Step 1 says is ammonia inhalants, those little ammonia tabs that you can break, because if they go into shock and they pass out, you can use an ammonia tab, ampule, whatever, to break and bring them back. He said that twice. That's a great idea.
Yeah.
Yeah, there's websites where you can get this stuff, and you can always use Amazon, to find if you can't find it anywhere else. I mean.
Oh, yeah.
Nice thing about having a grid up.
Absolutely. And so the SAM splint, and what else, Oklahoma?
Anything that you can use that is as sterile as possible to help control bleeding. One of the major things that you're going to run into in a SHTF situation is going to be fractures and lacerations. So you want to try as much as possible to control bleeding, and that can be anything from towels, gauze, ACE bandages, anything like that. The best thing you can do is keep a good stockpile of sterile ACE bandages sterile gauze pads, 4x4s, and ACE bandages to help control bleeding, and the SAM splints and ACE bandages. And if you cannot get hold of any SAM splints, then it is just as easy to go out and buy a bunch of paint sticks, those little paint stirrers that will help with stabilizing a fracture.
Good to know. Or if you have to, you can also get sticks or whatever if you need to,
Sticks,
stabilize
PVC,
if you need to.
anything you can find that is very rigid and as flat as possible and as long as possible to help stabilize the injury.
Yes, absolutely. Well, guys, it's been an hour, so we better cut this off. Thank you, guys. If you have any more suggestions, Oklahoma, please either send it to me in a message or comment on either Steemit or YouTube so I can add to the list before I put these on tomorrow. Anybody else have suggestions? I know you probably suggested a lot over in the side chat, and I missed a lot of them. So if you'll re-add those back under here on YouTube, that would be awesome. After this post.
Yeah, absolutely.
Yeah, you know, the way you describe EpiPens, it sounds like that stuff that Dr. McCoy used in Star Trek called cordrazine. But you know that they're going to have at some point, just like they had in Star Trek. I mean, it's like medical, like especially like in countries like India, they're going to have like little handheld. You can turn your cell phone into like medical device where you get a doctor on the other end, and you can diagnose situations like the medical tricorder they had. That it's like the science is evolving very rapidly, and it's kind of like mimicking Star Trek, and as far as like medical tricorders. They're going to kind of be cell phone-like devices or iPad devices, but it's going to be a thing very rapidly.
Oily, I had one thing to add.
Sure.
At the beginning, you were talking about gloves, and you were talking about non-latex gloves, and at that point, work decided to call me with a non-emergency and I was away from the show for a while. As far as non-latex gloves, the material is called nitrile, and it has two advantages over the latex. The advantages are, one, if somebody is latex sensitive, nitrile they won't get an allergic reaction off of. Two, it's more puncture resistant. The disadvantage is it's more expensive, but it's really not that bad. I also recommend that you don't skimp and get something thin. Get an 8 mil nitrile, and I know that might sound a bit excessive, but we use these things at work mostly for the cleaning crew and whatnot, but we do have them on hand for first aid situations. And since whenever they give me a safety budget, I always order the 8 mil. When the cleaning crew orders theirs, they order the 2 or 4 mil, and they're always coming to me for gloves. These things do tear. If you put them on your hand and you've got bigger hands and you're trying to fit a medium on an extra large and you've got a 2 mil or 4 mil, you will rip that thing. But if you've got an 8 mil, it might look a little funny, but it'll hold tight, and it's more puncture resistant. So just if anybody's looking at buying a box of gloves, just look at 8 mil nitrile gloves.
Excellent. Oh, good to know. I've heard the Venom brand is really good.
The what brand, Oily?
Venom, Venom.
I've never heard of that. That is a good point he brought up. Also, if you cannot get a hold of nitrile, then oh my goodness,
they've got them at Costco.
What is the other one?
Costco sells nitrile gloves. I know that.
Kojo just got juiced.
Kojo!
He's bad!
But anyways, as far as if you cannot find the 8 mil thick gloves, also look for high risk gloves. They are they're the same thing, it's just a different name. So if you can't come up with any 8 mil thick, then look for high risk gloves.
Okay. Good to know.
Vinyl. Vinyl was the other one. Latex, vinyl, or nitrile.
Yeah.
Okay.
Yep.
All right. And then there's a difference between hypoallergenic and non-allergenic. Non-allergenic So remembering that. Okay, guys. Well, if you have any more suggestions, please put them below. Yes, homesteading with the cases. Sorry you're late. We're getting off the air now, but it's every Thursday, 8 Central, 9 Eastern Standard Time.
Don't be late.
Yeah, anytime. Come and join us. We'd love to have you here, and thanks for coming this week. And thank you to the new ones that came and stopped by for the first time. We appreciate you coming, Elu, and all of the rest of you. Yes, thank you very much. Thank you, Oklahoma Prepper, for your expertise in this area. And
I look forward to your videos.
Gave us advice and helped us cover a lot of things that we would otherwise have missed.
Good night, VC.
Good night, everyone. Thank you all for coming. God bless you all, and we'll see you next week. Bye.
Have a good night, everyone. Stay safe and keep prepping.
Keep prepping.